Good afternoon. So, we are professionals. Till now, we have discussed how to save money by setting up a advanced super specialty clinic. But do we ever think when we are starting practice that our professional safety and our personal safety is equally important apart from our work? For a secure career, you need to have professional security, and that you need to have your own personal indemnity insurance, hospital indemnity insurance if you are a eye care center owner, and then a social media and legal protection nowadays in case you require. And profession is not the only thing. You have to take care about yourself, your personal health. If you are young, especially if you are starting your practice, it is always better for the security of your family to have a term life insurance. And then all professionals, we do have our own vehicle or vehicles. Do we need to insure them at a discounted price? We need to think of bundling all these 6 products into one in such a situation that you need to protect both professionally as well as personally. So professional medical indemnity insurance is an insurance plan to financially safeguard medical practitioners against legal costs and claims for compensation by patients in case of a legal row. The doctor's expertise is protecting the health of their patients, and medical insurance experts advises the doctors how to protect their professional interest. So, why professional indemnity has become a necessity for doctors, why is it strongly suggested is there is a staggering increase of 5.2 million medical negligence cases annually in India. About 110% increase in malpractice cases, whopping 400% surge in legal battles, and with the rise of negligence claims, it is critical to safeguard our rights of doctors by taking this insurance policy. Otherwise, you are working hard, you are struggling, and now one case comes on your head, then you are lost. So, we need to understand one technical term that is called a vicarious responsibility of a hospital. Vicarious liability means a party is held responsible not for its own negligence but for the negligence of another. In the context of medical malpractice actions, hospitals can be held directly liable for their own negligence or also can be held vicariously liable for negligent actions of your employee. So, the hospital is legally liable for any malpractice committed by a physician, nurse, or any other healthcare providers who are employed by hospital or even your visiting consultants. In such a situation, apart from your personal professional indemnity, you need to cover your hospital by taking a hospital indemnity insurance. The scope of professional indemnity insurance is to provide cover to the extent of the financial damage, and it also covers the cost of defending oneself in the court of law, that is the cost of decree. So, compensation under the professional indemnity policy, the policy will pay the sum assured that has been set as a limit. Any expense over and above has to be borne by the doctor. Indemnity insurance policies should be taken for doctors and hospital staff separately, as I enumerated earlier, and should be renewed every year to meet the claims of Consumer Protection Act. What we need to know, one insurance agent will come to you, he will offer a 1 crore policy X amount, whereas why another person comes and offers the same 1 crore at probably a lesser amount than what the initial company announced. So what you need to know are two technical terms. AOA means any one accident. If it means 25%, that means even if you take insurance for 1 crore rupees, the limit per accident is covered only up to 25 lakhs. That is why the premium is less. So this you need to know. And any AOY means any 1 year as I did this thing. So these are the copay and the riders which decide your insurance premium. The most important clause to be understood, this act has to be committed during the period of insurance commencing from retroactive date and continued thereafter without a break. Last year I have taken a policy. This year, due to some exigency, I have failed to renew that thing before. Even if there is a 1 week gap, the retroactive date changes to this date and not 1 year back. So if there is a case against you, say 6 months back, you are not covered. This is important. Unlike other insurance policies, there is a grace period to renew your premium, but for indemnity insurance, you need to renew your premium before the due date. So the take-home message for professional indemnity, there is no grace period and the policy should be mandatorily renewed before the due date. So with all these things in mind, All India Ophthalmological Society, we floated AIOS Suraksha, which we have widely publicized through email to all the members. And we have selected this Cover You because the Cover You is India's largest insurance broker purely for healthcare personnel. They give policies only to doctors of different disciplines. So we thought these are the best people. And about the company, they are IRDA recognized. They cater to over 75 professional organizations. They have a network of medico-legal loyal panel, 10,000 all over the country. Senior doctors panel, even we have enumerated 8 AIOS members, senior members, to guide you in case there is a problem. And over 5 lakh plus doctors have taken this policy. So for AIOS members, we have introduced this Cover You. Professional medical indemnity insurance, they offer comprehensive coverage, zero compulsory access. As I said, they cover you 100%, and even for ophthalmologists, oculoplasty and ocular oncology procedures are included for AIOS members. Unlike the premium is almost double for oculoplasty oncology case, but for ophthalmologists, they have agreed to give at the same premium. And all these benefits, because of the paucity of time, I can't enumerate all the 18 benefits that you will get if you get it through Cover You. Like my own personal insurance, like we were paying almost 18 to 20,000 for 1 crore insurance, which now we are paying only 6,400 because we have bargained through AIOS, and all AIOS members can take 1 crore insurance at just 6,400 rupees. So there were 6,500 rupees. So this is the power of group, and we strongly recommend from AIOS side, all the members can avail of this facility. Hospital professional indemnity insurance, again, you need to take a cover if you are an eye care center owner. Then cyber security, apart from the indemnity insurance, what we provide is a cyber insurance of 20 lakhs. Personal accident cover is also included, and various other assistance like legal notice, how to reply to a notice. If your insurance claims are handled, if they are stuck, they will help you, they will guide you, they will provide legal assistance to you. You can opt for this cyber security, social media and personal accident cover also. And on your personal front, you need to have your health insurance. When I turned 40, I celebrated my 40th birthday by taking a medical insurance policy, because we practitioners, like, we are not covered. Every day is working day for us. We are glorified daily wage earners, to be honest. So you need to have your own personal health insurance to cover your own this thing. Family benefit scheme of AIOS is there up to age of 49. After 49, then what? These people provide you term life cover as a security to your family up to the age of 60. And last but not the least, your motor vehicle insurance. Even if you have 4 vehicles in single insurance policy, they are willing to cover. Just one policy, they will cover your 4 medical motor insurance plans at a discounted rate. All these brochures are uploaded in the website in the form of AIOS Suraksha, and like you only need to click on AIOS Suraksha tab, and then what they have done as an initiation, this thing is like if you go and click AIOS Suraksha on the AIOS website, by entering your membership number, by entering an OTP that comes to your registered mobile number, if you fill up the form, furnish them all the particulars, like you have to furnish about all the 6 policies. It's up to you later. They will approach you at your given time, at your given the day. We have made it sure that only members who have registered, they will give you an automatic 10 lakh complimentary insurance. If you upgrade it to 50 lakhs or 1 crore, they will give you an additional 10 lakh cover for the first year. So we have a stall here, stall number 339. In case any one of you are interested, you can go. Just go to this AIOS Suraksha tab on our website, secured now. You get all the 6 brochures, study them briefly, whatever is required, whatever is your requirement. You need to cover yourself both on your professional front as well as on your personal front. So this AIOS Suraksha is a small 1-minute video. You just need to enter your number. You have to, they will send you an OTP. You just need to verify the OTP. And once the OTP is verified, you get all the 6 brochures on your site. If you click any of the thing, professional indemnity, hospital indemnity, everything, you just have to fill this form and then submit. Once you submit, you can you can specify the date and the time when you want the cover you people to call you. They will call you, and then as per your requirement, you will, once you fill up this form, you will automatically get a 10 lakh complimentary cover, and then rest is up to you. They will approach you for the other products. In case you are interested, you can take it. Otherwise, for the first year, your 10 lakh policy stands. So we are aiming that about at least 2,000 AIOS members form a group. Group is all that matters, and then we can go about it. So thank you very much for your patience here.
This premium is irrespective of the age?
Yes, indemnity insurance is irrespective of age.
And health?
Yeah?
Health?
Health is dependent. That's why I didn't specify that. Health is up to you. Pre-existing diseases, age of your this thing, everything matters.
Thank you very much, sir, for elaborate coverage of the insurance premium policies.